Hello everyone, myself Dr. Kunal Mukherjee and welcome to my channel The Dental Insights. Today I'm going to talk about dental implants. Now, we all know what dental implants is. Dental implants is the most fascinating thing for every dental surgeon, a most passionate thing for every clinician. I think despite of any different department from dentistry they belong to, everybody is very much interested in learning dental implants. So, today my topic is not more into dental implants. I'm going to talk little about the bone. Yes, the alveolar bone. What? Because because the alveolar bone is where we are going to place the dental implant. So, first let's understand what is alveolar bone is made up of. Of course, in human body, bones are made up of osteocytes. Bones are made with a deep, beautiful bone tissue. Now, let me explain more details about alveolar bone. Alveolar bone is having minimum two components. One is an outer cortical plate and an inner spongy bone. So, outer cortical plate and the inner bone, also known as the cancellous or the trabeculus or the spongy bone. Now, why it is so important for a dental implant is, remember the dental implant is having 3 to 5 different kinds of bone quality. First of all, I want to talk about a bone quality known as the D1 bone. So D1 bone is the most thickest and the more coarse bone for a dental implant. So why it is D1? Because the bone is consist of a outer shell or outer covering which is completely made of a cortical bone, and what this cortical bone is the most toughest bone in our human body, and it is having D1 bone is having the highest number of cortical plate thickness. So it's just like a big thick plate and the spongy part of the bone is very less. So whenever we are going to put a dental implant on a D1 bone, we expect the most success because it is the strongest bone. And gradually, all the D1 from the D1 to D2, there are D3, D4, and even D5 bones. Now, my question is that in which bone the dental implant is best and it's why? Now, I'll tell. D1 bone, as I told, D1 bone is the toughest bone, and I told that a dental implant is going to have a very beautiful success. But it does have various considering factors. First of all, D1 bone is very thick, but the nutritional supply and the blood supply of the D1 bone is little lesser. So my question is, from where the blood system of the D1 is originates? Mainly, the D1 blood system is originates from periodontium, from the periosteal of the bone. Periosteum is the outer layer, the outermost covering of the bone, that is the periosteum, and where the majority of blood vessels are situated over there. And from the periosteum, the complete nutritional supply of D1 bone is mostly coming from. So, whenever we are going to put a dental implant, the small tip is that we don't need to reflect the flap much more, because we reflect much more flat. We need to curate the area and we need to place the implant over there. And most commonly, we are going to harm the periosteal tissue. And in periosteal tissue, all the nutrition for the D1 bone is there. So, definitely after a proper drilling protocol of an implant, when we place the implant, we expect the implant to osseointegrate with the bone, to fuse with the bone. The bone should have the maximum bone implant connections, also known as BIC, and we want the best healing. And at the time, if you don't follow the proper surgical techniques, we elevate a more flap and we have excess site more. What happens is that there will be reduction of the blood supply and there is always a chance of bone necrosis, and the bone necrosis means the bone is going to die. So yes, the implant is best in D1, but always we need to be very careful while during the surgery. So once we're using a D1 bone, make sure we are not going to elevate too much of flap, because we don't want to destroy majority of the major of the periosteal element of the bone. So next, D2 bone. I think this is the bone where we actually want. D2 bone is having little lesser cortical plate as compared to D1 bone. And of course, the spongy part of the bone is little higher as compared to the D1 bone. So what happens is this, when you place a dental implant in a D2 bone, the osteotomy preparation or the site preparation has become little easier because the bone is little softer than the D1 bone. And the most important factor is that the blood supply is abundant in the D2 zones of the alveolar bone. So, placing a D2 implant in a D2 bone always comes with a success because it is carrying the proper nutrition, proper blood supply. Even a little bit of extensive surgical procedure also need to be done. It does not create much of the trouble to the bone healing or the implant healing or the entire healing of the surgical site. Now come to the D3 bone. As the sequence I'm telling, the cortical plate become more thinner and the spongy part increases little bit more. So what happens is there, the implant placement is very fast when we need to use very precise drilling protocols. We should be very careful. We should not go more aggressive in this bone because the bone is already soft. Of course, there is abundance of blood supply, but even the too much of injury even might cause excessive bleeding and ecchymosis and different surgical complications. So again, when you come to the D3 bone, the surgical preparation you need to be very careful. But of course, the implant placement is going to be the easiest in D3 bone. But the BIC, the bone implant contact, will take a lot of time to achieve. Again, we come to D4 bone. The same concept, the cortical bone is almost like a thin plate, almost no to thin plate, and majority of the structure is covered by a spongy bone. So why? D4 bone also implant can be done, but the implant surface and the coating and various other properties and the biomaterial properties plays here the most, because we need to select the best implant, we need to select the biggest implant, we need to use the proper concept of D4 bone to make our implant success. And we need to use a beautiful technique of osteodensification to achieve better success, because we need to get more dense bone to place in around our implant to have the BIC. BIC is nothing less bone implant contact. Bone implant contact plays a major role in healing of a dental implant and retention of a dental implant and for the future of a dental implant. Now again come to the D5 bone. D5 bone is almost completely spongy when the trabeculae of the bone is very higher. So generally implants are not recommended on that bone. So we don't touch a patient with D4 bone. We do have D4 bone, but D5 bone, but D5 bone are very thin, so dental implants are never successful in this. It's always tricky to place. So which is the ideal bone for dental implant is always remember is a D2 bone. D2 bone is the best bone. Now my question is, in which zones is having the D2 bone? D2 bone are abundantly present in our mandible. And D1 and D2 is abundantly seen in the mandible. It is mostly D1 is mostly present in the anterior region, and the posterior regions is having D2 bone, and then sometimes D3 bone. But D4 and D5 bones are very less in mandible. But once we come to maxilla, we don't even, there is less than 1% of the area of the maxillary alveolus is having D1 bone. Almost the maxillary anterior zone is having D3 bone and posterior is having D4, or else it might have D2 bone and the posterior is having D3 to D4 areas. So we rarely see D1 bone in maxilla, but mandible we definitely see a D1 bone, but mostly up to canine regions. So this is about a little brief about the different types of bone and its implications to a dental implant. Thank you.